So my name is Heather Chase, and I'm a community developer with Horizon Health, and I work in the population health department. So our role is to look at things that impact the health and well-being of the community. And one of the important things to recognize is that we know that health outcomes come from a lot more than just accessing doctors and nurses and hospitals. That's still very important, just to be clear, but you derive most of your health benefit from things other than access to primary care, and we call them the determinants of health, and I have a slide on that. But one of the things I do want to just point out, is there?
I have to.
Okay, I can talk.
Yeah.
One of the things I do really want to point out is when we look at things at the community level, which is where I work and a lot of people in this room work, that's the intersection of everybody. So whether you're a developer or you're an employer or you're a person looking for a home or a municipal government, we all live in the same community. And it's really important that when we look at these kinds of solutions, especially solutions that are people-focused, it's that we're all working together because we all have a role to play. So one of the best assets that we have in Charlotte County that I'm aware of is our very tight team of community partners. So Ray Funk isn't here today with Vibrant Communities, but Ray and I are joined at the hip quite a bit because we both work on a lot of the same issues. We work quite closely with the Regional Service Commission and the Planning Department, and we have been on housing. We connect a lot with Kendall and with Glenn and Brianna at ECW and Jim at Neighborhood Work. So when we look at community development, we always like to focus on something called asset-based community development. And that's really focusing on what we have to close the gaps instead of the gaps that we have. So by working together, we can really move forward with innovative solutions. Thank you, Xander. And sometimes, this is the airy-fairy stuff for some people, but this is where the rubber hits the road. So I'm going to talk just very briefly about some of the community and social impacts of housing. And I do always like to remind people that it's bidirectional. So what can impact housing impacts our social and community, and vice versa. So one of the questions when I talk about housing I like to ask is, do you know where you're sleeping tonight? Because we have a lot of people who don't. And it's really important that when we look at housing, we think of the whole housing system, whether that's your multi-million-dollar homes, whether it's apartments, whether it's affordable or inclusive housing, whether it's people on the street. We have to look at housing from that whole continuum because that derives the best benefit from our community. The challenge along the way is that the intervention or the solution we provide looks very different. So just remember, we have a lot of friends and neighbors that don't know where they're sleeping tonight. One of the biggest things for me when we talk about housing is that we really need to think about investing differently. And from a community and a health and a social lens, one of the places we can start thinking about investing differently is how we invest in things like healthcare. That's obviously the sector that I work in. But as I mentioned at the start, we know that most of the health outcomes come from things other than accessing healthcare. And it's really the determinants of health. So this is a framework that we're starting to see more and more in New Brunswick, which is really encouraging because that means we're focusing on upstream investment. And you might say, well, how does that impact me? If you're an employer and if your employees are more comfortable with their determinants of health, you have reduced turnover, reduced costs, and a more productive workforce. If you're a teacher and your kids in your class are more comfortable with their determinants of health, they perform better in school, and you have better interactions with their families, and again, there's better long-term outcomes. So we really try to focus on all of these components that we can so that we're really trying to shift the needle instead of doing Band-Aid approaches. And when I talk about investing differently, and it is investing, we're not spending, we're choosing where we spend our money. If you look at the healthcare system, 88% of our investment is spent in medical services, 4% is spent on healthy behaviors, and 8% is on others. But when we look at what actually makes us healthy, it's 50% are healthy behaviors, so that's like access to food that's healthy and makes me feel good. Active recreation, close to nature, being able to complete school. That's 50% of our health outcomes as an individual. 20% is environment. So if we're looking at land use planning, climate change adaptation, 20% comes from there. 20% is genetic. That's kind of hard to change, but you can change it a bit. And then 10% is access to health. So I really would hope that we can start to think about this differently. And why it's important is sometimes when I talk to landlords, let's say, if they're trying to house individuals with multiple challenges, it can be really challenging. But if we invested in our healthcare system with what makes us healthier, we would see more wraparound services, and we would see an improvement in long-term retention. I know some of the landlords that I talk to, they have challenges with how people support and maintain their housing units is a challenge. Sometimes that can be impacted by perhaps a mental health issue. Not always, but sometimes. Or did someone ever teach them how to look after a home or maintain a home? So it's important to think about this. And although this is through the health lens, it's through everything else it's important to think about. One of the things, just very quickly, because I can geek out on this stuff and I know nobody else really sometimes likes it, but I have the chance. So when we think about population attributable risk, that means what percentage of a health or social issue can be attributed to, in this instance, childhood trauma. And 70% of our population has some form of experience with childhood trauma. We're not going to get into the whole big, deep discussion today, but I have cards if you want to later. But the most interesting thing is if we look at this percentage of the population here as homeless as an adult, if we ensured that kids grew up in a healthier and safer environment, 62% of the population, we would reduce the issue of homelessness as an adult by 62%. So there's very few things that we can do as a society and as a community that will generate that type of return on investment. So I'm really hoping that we can start focusing a little more on those upstream investments to increase our return on investment, whether that's through our tax dollars, whether that's through our private sector dollars. It all feeds into the same thing, and it all has to be complementary. So one of the most interesting things that we've seen with the housing issue is we're really trying to deal with a community development approach to this issue. And that builds on the fact that we know through the determinants of health lens, there are multiple partners that have to play together to see those good outcomes. And one of the things that we do in community development a lot of times is we start with coffee and conversation, because it's all about relationships. And how this round of housing work in Charlotte County started was myself and Ray at Vibrant Communities got together one day, had coffee. We were both seeing some housing issues. Then we talked to Alex at the Regional Service Commission, who connected us with Xander and Vivian, and then we connected with Kendall. And the biggest thing with community development is it's really a multi-partner approach with community at the center. So that's really the start of a lot of this work. It's not bringing people in, it's how can we look at this from our community lens and work on this together. Then we bring in resources as necessary. But from that conversation, that led to the study that Xander referenced today. So really good team approach on getting that scoped and funded. Vibrant Communities actually provided the seed funding for that. So again, working with another really good partner. Then that led to our region being selected as part of a federal program called Campaign 2000, where we're looking at how housing can impact poverty. So we're actually part of the national conversation now. And St. Stephen was selected as the only community in Canada that had housing focused on it. And again, good community partner, CHCO, was actually helpful to come and do some interviews with people who participated. So just to raise that profile of housing, where we had individuals who are housing insecure come and take part in that process. So that also helped lead to the symposium you're at today. So one of the things from a community development approach is that it doesn't always happen overnight, but usually when we get to where we're going, we have a better solution. So what's the proverb? If you want to go fast, go by yourself. If you want to go far, go together. I know I butchered that, but that's a really good one. And we definitely always try to go together places, especially for something like housing. Because what we know from housing, if people don't have access to safe, affordable, accessible housing, and that's for everybody, The stress on a family around can they make their mortgage or rent payment. We have kids in the county who are dropped off at school in the morning and don't know where they're going to after school. So how hard is it to sit there at school and not know where you're sleeping tonight? So if we don't work on the housing issue, we're going to continue to see housing issues and all of the related social and community-based issues that we're having. So when we look at really creating a healthy and vibrant community, we want to focus on improving outcomes at the individual level, family level, business level, and communities. Housing is the constraint, whether it's economic development, whether it's health outcomes, whether it's educational outcomes, whether it's civic participation. If people don't have a safe place to sleep at night, they can't participate. And I think we all want to focus on having healthy and vibrant communities. So again, I have detailed information on stats if anybody wants them, but we just wanted to provide a little bit of time today to talk about the personal side of housing. It is the constraint. The issues that we're dealing with typically can be all traced back to that, and I'm happy to send any follow-up information out. But just so you know, there's a really good asset team in the county that is trying to work on this. Everyone else is always invited to the table because that's how we do communities. So thank you.